Yeah. So we had 2 hours of Rein talking about the financial and about the incentive systems, and Rein, and you basically got your cow, Rein. A couple of follow-up questions. First, can you very quickly summarize the amount of money you spent, how much money your organization spends, just the basics about your organization?
Estonian Health Insurance Fund, our revenue is 2.2 billion euros annually, 2023, and our operating cost is less than 1%. And this 2.2 billion euros, we are helping Estonian residents.
Yeah. How many people work here?
Our staff is 204 people, and the Estonian population is 1.3 million.
Yeah. Okay. Then the 2.2 billion, where do you spend it on?
Half of them goes to the secondary care. Primary care gets, which is 1.1 billion. Primary care, the medicines and the temporarily money for those who are not able to work, all portions are 200 million.
Yeah, so 10%
and then
of it.
There are smaller parts.
Yeah, but you also pay 10% of your budget is for paying people who are sick after the third of our
like sick leave money.
Yeah, okay. Then, if we look about innovation, you used to work for Microsoft, and you're trying to put in innovation, and you also changed the name of the organization. What did you change your name to?
Our organization name is the Health Fund. So basically, our first strategic goal is we are willing to help people to take better care about their health, because that reduces our all our cost for healthcare, at least in the beginning, because in the end of the life we most probably need it.
Yeah.
But then the money goes to the right place.
Yeah, and it used to be the sick fund.
Yeah, in Estonian it used to be sick fund, but
now it's health.
But I strongly believe the place where you look, where you focus, that you will get. We focus on the keeping people or being healthy, and recovering and then being healthy.
Yeah, huge differences in Estonia, north and south, and also even more between Estonia and Sweden about healthy years. The difference, even we heard yesterday, was 20 years. Why are the Estonians have so few healthy years?
First of all, this number comes from the people's own opinion that can you work and can you live without any complications about your health? And some people are saying that no, I still have some minor things. First come the mindset part, but in a real life it's a serious challenge, because we want to increase the healthy lived years.
Yeah.
And to do that one, everyone needs to start from themselves, look their lifestyle, and make some correction of errors, and everybody will win out of that one.
Yeah. But I mean, there is a big difference. 66 years old for people die, men, and 72 women. And in Sweden, it's much, much higher. Is it because the way they live, the way they eat, the way they have stress, the way they have...
Absolutely right. When we look back, we were 50 years under Soviet occupation. That definitely put some big footstep there. Another one is the general health literacy, and I think that it will take the 20 years when the new generation will raise. Then they put way more effort on how to live, what to do, how to do. How much to do exercises, etc.
Yeah.
And also there is a hope that if there are healthy youth and healthy young people, one day they become mothers and fathers, their children will inherit that lifestyle.
Okay, that's a good answer. Hey, we saw a dashboard of all the hospitals which get 50 or 60% of the total, and you could see everything, how much budget they were using on this and this and this and this. How actual is that data? How much is the information from the hospitals in your system?
This is a real life data, and our hospitals have learned that it's easier and beneficial for them to really give this data as fast as possible. Ideally, technically, even after the surgery, if you have all the data, you can do a few clicks, and the invoice is in our system, and money goes to the hospital.
Okay, so it's real time almost, and it used to not be like that.
Yes, we used to have, technically, even it's today legally, hospitals can deliver us invoices from 3 years past. But if you make the system in the way that there is the benefits and willingness from the hospital side to send us the invoice and make it as easy as possible and make all the checks, compliance and process in a smooth way,
Yeah.
people would love to use it.
You
And they're
changed
using
it in a couple of years. When you
this
came,
is
it was
last 2-3 years when we are changed that one, and I can say right now everybody, let's put it, majority of our partners are happy about that.
Yeah. Now you're going in to a meeting about the biobank and implement it, and doctors can have access to the factors of the patient. That is the new innovation which is coming on. Is that an expensive? Is that an expensive innovation? Do you think that will save money or cost money?
Definitely, it will save money, and I'm pretty sure it will save lives, and it will save also people from unnecessary complications. Because few years ago we gathered 250,000 blood samples of Estonians in the biobank, and now we can see first results for the people, because you are getting risk scores for many things. 3 areas which we are working is one is pharmacokinetic part. Idea is that you should take only these medicines which are helping you. Second one is a breast cancer avoidance, and some people we need to start screenings earlier than 50 years. And also cardiological risk score is helping you maybe change your lifestyle a little bit earlier, because we all would love to have nice and long life together with our friends and family.
Yeah, so that's today. That dinner is that meeting is today.
Today
the
is the
announcement
conference,
is today,
and
implementation will be in, or the first trials.
I believe in autumn 2023 we will see the next or the real actual results, because we need to test, and important part is also communication, because if you get the risk score, then with the plain number it might be vice versa, unnecessary fear, or vice versa, that the score is low, but you need to know the context and the scene behind that one.
Yeah, artificial intelligence. Do you see any future for that in your systems?
Absolutely, we love AI, and I am dreaming the system where the virtual assistant is participating the doctor and patient meeting and summarizing it, writing the epicries, and then doctors or nurses can dedicate fully their time to the patient.
Yeah.
We will save efficiency. We can easily then translate it, use it, write codes, etc., and write treatment in the right time, right place, and that everybody would love.
You formerly worked in the tech industry for Microsoft. Now you're in the healthcare industry, and you have strong opinions. You have strong opinions about health, that people should become healthy. You have strong opinions about innovation. Don't people, professionals, medical professionals, think you are that you're overstepping your boundaries as an insurance man, and that you're not a medical man?
We always involve them, and we share the ideas, and we offer the opportunities, and those projects which we are doing together, and without this cooperation you would never be successful.
Yeah, but my question is still, what do people think of you in your new role in this last 5 years that you've done this?
You should ask them, but I hope that they love the things which we are doing, and especially I would be happy if they say they love the way how we are doing.
Mm-hmm. Politicians, they need to basically fund the healthcare in the next 5 years. It needs to be increased and have more resources. Will that be controversial, or will it just be normal and it will work in the end?
I believe it should be in a balance, because if you need some extra money, which we do need, then it has to be very clear, both politicians and people, what they would get in return. Where this money goes from, what is or what will be the benefits, and that is our role to explain that one. And when we are successful, then I believe we will find a way.
Fun job?
Absolutely. Always wanted that, and this is even more fun than I imagined.